Hello everybody, I am Dr. Shobhasati Das. I am going to make another video today after a long time. There was a gap like of 3 months and we are busy. We are struggling with COVID for long duration. Then came adenovirus and gradually now things have come back to normal. Children are going back to school and things have normalized. So now I will be making a series of videos on different day-to-day problems of children. I have also created a group in the YouTube where parents can join and discuss among themselves the problems that they are facing in parenting. Like some parents may have issues with feeding, some parents may have issues with their child having difficulties in communication, with difficulties in behavior. Some children may have problem in with the mobile, whereas other parents are doing quite well with feeding. They are quite doing quite well with their children without mobile phone. So I have prepared a group. I prepared a community where you can join and exchange information among yourselves. Like it is a parenting community where people will be helping each other, and I will be present in the community and trying to guide the group with some scientific knowledge so that we can take out the best that our cultural practices gives us, and in that way we can overcome certain problems that we face as parents, like in feeding the child, managing a very picky eating child, children with obsessed with mobiles, children obsessed with games, children obsessed with misbehaving, conduct disorders, and also you can recognize early signs of autism. So we'll be discussing regarding every childhood problem, and I would like you to come up in this community and post the problems that you are facing with your children, and we'll be discussing on this topic, uh, me as well as among yourselves. So, and it is a paid community. It is a nominal fee of like 50 rupees or like that, just to maintain the community. So I welcome everybody to join the community and have a group among yourselves who can solve problems by themselves, become experts by themselves, and also start helping others in the community, outside the community group, in their local community as well. So, in that view, uh, trying to enrich ourselves with more and more knowledge, more and more scientific skills, I am very excited to open this community in my YouTube channel. Now, on this long list of problems that we'll be discussing, first today we will be discussing on constipation. Nowadays, I am getting a lot of patients with constipation, be it in the age group of 6 months or in the age group of 2 years, maybe up to 10 or 12 years of age. So, as we are moving forward towards a developing nation, our food habits are getting westernized. We are eating lots of refined foods. We are children are very fond of this fast food, and this is linked to this lifestyle problem of constipation. Now, what is constipation? We have to know what is constipation. If a child is not passing stool as per his regular routine and he has difficulty in passing stool, he is training, he is trying but not able to pass the stool, and this phenomena, this problem is causing distress to, to the child, then we have to help him, and then it is a problem, then is a problem of constipation. Now I come across children who are not passing stool like 7 days, 10 days, 6 days, and Sometimes while passing very hard stool, there is tear of the anal region and blood comes out. So once this tear or injury to the anal canal happens, it becomes a vicious cycle. Because once there is a tear, there is pain. The next time the child is having urge for defecation, he remembers that there will be pain while passing the stool, so he himself tries to hold the stool, and in that way, the stool that has been held inside the colon gets more hard, and ultimately, when it comes out, it again causes injury on the anal tear, deepening the anal tear further, and ultimately, with time and time, with repeated injury on the same place in the same anal region, there is development of anal fissure. This fissure is something difficult to treat. This fissure is something very painful, and it can last for a long time, causing lots of problems to children. So, this is the problem which we should avoid. Now, how can we avoid constipation? Usually, our Indian diet contains lots of fiber, like atta contains lots of fiber. Our normal boiled rice contains lots of fiber. Vegetables, fruits, cereals, pulses, and uh, all those unrefined foods contains lots of fibers. So there should not be any problem with constipation. But gradually we are moving towards more refined things like white rice, atup chal, like Govindo Bhog rice, Tulsi Bhog rice. These are very refined rice, and they tend to cause constipation. We are moving towards maida. Maida doesn't contain any fiber. So this is very notorious to cause constipation. So in children who are having this problem of constipation, we should be avoiding maida totally. But maida is present in disguise in so many food that is very difficult to avoid maida completely. One of the main things that the children are very fond of are biscuits, and biscuits are like 90% maida. So if your child is having constipation, you have to stop biscuit and cookies completely. There are only few biscuits available in the market which do not contain maida, which are based on atta and other things. If you can find them, you can use them. Otherwise, just completely stop biscuits and cookies in children who are having problem with constipation. Next is the bread, cake, Maggie, your certain baby foods. All these contains maida. So you have to be very careful while choosing some bread, which are like again 90% maida, some cakes which are again like 90% maida, some Maggie kind of things which contains lots of maida. So you have to completely stop these things. So maida is something which is very notorious to cause constipation, and in a child who is having problem with passing stool, having blood coming out of the stool, maida has to be stopped completely, particularly biscuits. Second, you have to shift from this white rice, refined rice, to yellow rice, boiled rice, which usually is being taken as a staple food in um, Indian families. Like this, you have this bashkati, then this minikate, ratna, and other things. So all these are normal, good boiled rice. Avoid atop chal, avoid tusi bhog, govindo bhog, and highly refined Dehradun rice. So this also causes constipation. Now, what are the things that you can give to your child to have a good motion? These are number one, lots and lots of vegetables. Because vegetables contains fibers, and there are in India different types of vegetables are available in every season. So seasonal vegetables you can use, even cook it, you can boil it, you can make curry with it, apply whatever spice you want to give, whatever oil you want to give, cook it, and then make it tasty and give it to your children, no problem. So giving lots of vegetables and at least one fruit a day. It can be any fruit. It can be some apple or some watermelon, mango. It has to be seasonal fruit. So anything, any fruit, from banana to guava to anything that you can lay your hand on and you can give it to your child. It's better if the child is eating the food as a whole, along with the fiber, than drinking the juice out of the fruit. So eating a whole fruit is very helpful for a child who is having this problem of constipation. Particularly pear, guava, mango and banana are very helpful in relieving constipation. Pear is something which is not available all the year round, but it is very helpful. Guava is also something which is now nearly all available all the year round, and is also very helpful in relieving constipation. Now, third comes water. You have to give adequate amount of fluid to the child. Like a 10 kg child should be drinking like 1 liter. A 20 kg child should be drinking at least 1.5 to 2 liters. So fluid is very important, and it has to be taken constantly throughout the day. And if it is very hot weather, then the fluid intake should go up, and there is no upper limit of taking fluids. So more the water, more the fluids where the child is getting is better. Now, ultimately, if there is a problem persisting even after doing all these home remedies, then you have to go to your doctor and get some medicine. And this medicinal treatment is for long term, like 3 months, 4 months. Only then it helps. And if there is a fissure inside the anal region, if there is blood coming out every time, then you have to contact your doctor and go on applying some medicine to the anal region, and it has to be continued also for long duration, like 1 to 2 months. So if there is blood coming out, if there is constipation in spite of this modification in the diet, you must contact your doctor, because it can lead to anal fissure and it can become a long-term problem for your child. It can cause a decrease in appetite, the child's growth, the child's feeding habits may go down, and you may face lots of problems. So whenever you find your child getting constipated, correct this dietary modification, do this dietary modification, and even after that it is not helping, contact your doctor. Now finally, I would touch on a point of toilet training. Usually, uh, we do not recommend toilet training before 2.5 years of age, because if you start to try to toilet train your child before 2.5 years of age, there may be some problem and it may lead to constipation. So do not try to toilet train your child before 2.5 years of age. And something like after 2.5 years, um, making a habit of going to the toilet for passing stool after breakfast is something is very helpful to the child, because in children there is a urge of passing stool after taking food. We can use that You can use that reflex, we call it a gastrocolic reflex. So in the morning after taking breakfast, there will be some urge, and if we make a habit of going to the toilet to pass their stool every time after breakfast, it may help them, it may make an habit. And if they are not holding up the stool and it is being cleared every day, the chances of constipation goes down. So thank you for hearing. I would like to get some comments on what videos you want me to make, and I am very excited about that community. You can join them. I will be on there and also trying to guide you on different problems that you come across in your daily life with your child. So thank you. Have a great day.